Hello, and welcome to Back to Basics Virtual Massage 2. Yesterday I had the opportunity to go over several types of techniques to help people with low back and hip pain. There were a few muscles that I left out because I was trying to keep the video to a reasonable time frame of under 10 minutes. So today I just wanted to take a few more minutes to go over a few more muscles, a few more techniques that would help you with low back pain. The primary flexor of our body is called the iliopsoas muscle, your runner's muscle. I want to show you a picture of it. The iliopsoas muscle is located on the anterior side of your lumbar vertebrae. This muscle is massive, and it's on the left and the right. And what it does is it flexes, it pulls your leg up towards your torso. So just to give you a good idea, I just want you to see what that looks like and how big this muscle is. I'm going to tap on it so you can see it kind of colored out there, your psoas muscle. I would suggest getting on Google app of some sort and finding this one in particular is an interactive 3D anatomy, which is amazing. This is the iliacus muscle right here, which we're also going to work on today. So the iliacus and the psoas, primary flexors of your body. Let's get started. Overlying your abdominal area are the abdominal muscles. Incredibly important to keep strengthened. Doesn't mean you have to do full-blown sit-ups or strain yourself if you're not used to that. What you can do, again, to help with low back discomfort, low back pain, to strengthen your core, you can simply lie on your back with your knees bent, and what you're going to be doing are just contractions from the front of the center of your pelvis, your pubis bone, front to the sternum. What you're going to do is contract those muscles. I want you to think about your abdominal muscles, contract those abdominal muscles. Again, you do not have to do full-blown sit-ups to stimulate abdominal muscle strength. Another thing that you can do is think about pulling your right shoulder over towards your left knee. You don't have to lift up all the way, just that idea of contraction. And then the same thing on the opposite side. So crisscross, straight forward and side to side. You can do them slower with a breathing pattern if you prefer, but strengthening your core is key. You can look online for more exercises to strengthen your core muscles. The psoas muscle is underneath here. So lying on your back, having your knees bent, putting your hand on top of your hip bone. What you're going to do is curl your fingers over top of your hip bone. So you're working down towards and around the inside of the bowl of your pelvis. So imagine your pelvis here. Your sacrum is triangular, your pelvis is like this. This whole inside bowl of your pelvis that is a scoop of muscle called your iliacus. And the psoas is running along inside of here, right behind it. And you can actually stimulate massage to these muscles, and I'll show you how. So you lay down, you're going to take your fingers over top of the iliac crest, your hip bone. As you slide your fingers over top, you're going to curl back around and in and towards the outside. So you're not pushing down, straight down into your abdomen yet. What you're doing is you're curling around that hip bone. You're looking for sensitive, tender, good hurt areas. When you find a sensitive area, don't shy away from it. There's a difference between a good hurt and pain. We're looking for good hurts. Those are solutions. Those are the spots we want to find. So take your fingers around that hip, find that sensitivity, and again, what you're going to do is just hold it. You do not need to move. You do not need to massage it. You just need to hold it. Compression that feels like an efficient amount of pressure, but not invasive. You want the pressure to feel effective, like it's doing something to that muscle. It'll feel bruisey, it'll feel a little tender, but like I said, it should feel like a good hurt. I know I'm repetitive, but those are key words for you to remember, because as we work through different areas, working on knees or elbows or shoulders, which I got a couple of requests for, so I'm going to do that next. It's the same technique in different areas, where you're finding a spot, you're compressing it, you're focusing on it, you're taking a deep breath, Telling that muscle disengage. Giving the muscle permission to turn off. Taking a whole nother level of control of your muscle. Because it's so used to being on, so used to being contracted. You need to calm your body, you need to calm that muscle, and you need to take control. You'll then move to another spot. So the whole inside of this hip bone, there are 3 or 4 different spots that you're going to curl around that hip bone. And again, moving my fingers, with my fingers around my hip bone, I'm curling them around back outward towards you, towards the camera. And as you find, and you can move higher on that crest of that hip bone. So that whole pelvis, you're working around the inside of it and trying to get to that top edge up. Again, when you find one, you're just going to hold it, take nice slow deep breaths, disengage. Talk that muscle down. You want it to release. That's the iliacus muscle. The psoas is a little bit deeper and more in. You simply bring your fingers, again, around your hip bone, but instead of coming back and curling around, you're actually coming down and in on an angle. Now there's lots of other things in your abdomen. You don't want to be poking and holding on the wrong thing. What I want you to do is gently come around the hip bone, kind of angle back down towards the ground, towards your belly button, but towards the ground. And then if you gently think about pulling that knee up, that you're the same side that you're working on. As soon as you begin to pull it up, you'll feel a flex. You'll feel the muscle move underneath your finger. If that's too difficult to do, working even just the iliacus, just curling around that hip bone will help with a pretty good amount of pressure. Again, you don't want it to be painful. You want it to feel tolerably tender compression. That's working on the psoas muscle. Another thing you can do for that psoas muscle is a stretch, a runner stretch. You want to make sure you have some sort of padding. I have yoga mats down. The knee that is down is the psoas that you're going to be stretching. Your other leg is going to be up in front of you. It is incredibly important that your knee does not go past your heel. So make sure that your foot is far enough forward that it gives you plenty of room to lunge into. Keep your back straight. Hold on to something if you need between the bed and the dresser, or between the sofa and an end table, something to stabilize yourself. This isn't about balance. I don't want you, it's not an exercise, it's a stretch. And I want you to be able to focus on what it is you're trying to stretch, which is your psoas and your iliacus muscle inside the hip bone. Gently, what you're going to do is stay nice and square. Keep your shoulders back. Do not lean forward. That takes the stretch completely away. Keep your shoulders back. Put your hand on your hip or be holding onto something, and slowly you're going to lunge forward. The knee that is down is the psoas that's getting stretched. And again, once you get to this position, nice slow deep breath. Focus on the inside of the hip, and then release. Feel that groin line area stretch. Slowly come back out of it, and make sure you do the other side. Always stretch both sides, even if only one side of your hip or low back is bothering you. So that covers the abdominal muscles, that covers the psoas muscle. The other muscle would be the hamstrings. Incredibly important to stabilizing the pelvis. Hamstring work, again, you're on your butt, back supported by something, the sofa or a wall. You're going to take your fingers underneath your leg. You're going to use your fingers as a pry up. If you have a back knobber tool that I introduced yesterday that looks like this, that would be fantastic. If not, you can use your hand. I'll show you both ways. You start at the knee, not in the center behind the knee, but a little higher. What we're going to be doing is tendon compression on hamstrings. So you're putting your fingers behind your leg and you're feeling for that ropey tightness. It can be tender, bruisey feeling. That's what you're looking for. Don't shy away from that. Once you find a good spot, push your fingers up into that muscle. Not just a little, not crazy, just a moderate amount. You're looking for a good hurt. It should feel like an effective amount of pressure, but not invasive. Deep breath. Disengage. mentally tell that muscle, thank you for working so hard, but I want you to turn off. You're training your muscle for you to take control on a whole other level. You're turning your muscles off, giving them permission to disengage. And then you move up. And there's all kinds of spots all over the back of your legs. Some are on the outside a little bit more, some are in the middle, some are on the inside under. But this is one way that you can work on that hamstring. Stretching feels amazing, but sometimes you might have a hypercontracted fiber that's within the grouping of the muscle. The muscle itself is stretching, but that one fiber is not releasing. That's why trigger point therapy is so effective. You could use the back number tool. You could use the short end of it, put it underneath your leg. And again, you're just looking for good hurt spots. And you're levering that tool up into the bottom of the hamstring. And when you find a good spot, you just hold it. And again, it's focus, it's breathing. It's telling that muscle to disengage. So that covers the abs, the psoas, and the hamstring. I hope that helps a little bit more. There are so many other things that are involved with properly administered therapy. But these videos are just designed to give you a couple of new techniques to work on yourself with. I work on myself almost every single day. I work hard, I play hard, so I require a lot of therapy. So hopefully this helps you guys, and as long as everyone's responding to the videos and enjoying them, I will continue to do them on other areas. So God bless, and hopefully we'll see you soon.